Hello, everyone. Welcome back to our latest lecture in the series of college biophysics for health science majors in speech language pathology, assistantry, physician's assistantry, optometry, and beyond. Here we're going to be looking at just standard medical imaging, some examples being sonography, radiology, and nuclear medicine. This is going to be a very short lesson, and we're just going to be getting into some different ways of performing medical imaging on the human body. As far as medical imaging goes, most common types include sonography, which is what ultrasound is. There's radiology, which includes conventional X-rays or radiography. It also includes computed tomography, which are CT scans, or what they used to be called, which was computed axial tomography, which was called CAT scans. And then there's also magnetic resonance imaging, or MRI. There's also nuclear medicine, such as single photon emission computed tomography, or SPECT scanning, and positron emission tomography, or PET scans. Sonography, ultrasound, this is a method of imaging that uses high-frequency sound waves. This is just to give structural information about what's inside the body, and the purpose is just to construct a 2D image of the soft tissues in the body, sometimes including a developing fetus, a developing child. The benefits are this procedure is non-invasive. Ultrasounds can come in small portable packages that are easily accessible and relatively less expensive. They're great for soft tissue imaging, such as of the womb, bladder, ovaries, fallopian tubes, and other organs of that nature. The cost can range from $100 to $1,000 for a scan, and the scanner itself can be $5,000 to $200,000, which compared to what we're going to be talking about later in this video is actually not that bad. The limitations, though, is that sound waves do not travel well through air or bone, nor is it able to see objects that are very deep in the body. Conventional X-rays, these are the things that you hear your dentist talk about if you ever get an X-ray of your teeth, or if you've ever had to, if you have scoliosis and you got an X-ray of your back. The method of imaging is the use of high-frequency electromagnetic waves, specifically X-ray radiation. This is just meant to give structural information about what's in the body, and the purpose is to build a 2D image of areas of bone or high calcium, because these simple conventional X-rays pass through most tissues and most structures of the body, but are stopped by bone. Hence, we're able to actually see bone on radiography or conventional X-rays. The benefits are these are suitable and non-invasive method for spotting fractures, dislocations, misalignments, and even narrowed joint spaces. It's a cheaper option at about $100 to $1,000 for a scan cost, and the scanner costing more from around $20,000 to $200,000. The limitation is that it will not detect subtle bone injuries, nor inflammation, nor soft tissue conditions. Computed tomography, or CT scanning, which used to be called computed axial tomography, which is why we still hear the term CAT scan, is a method of imaging that uses high-frequency electromagnetic waves, which are X-rays, but more advanced than conventional radiography. CT scans or CAT scans, they only give structural information of what's in the body, and the purpose is instead to build a 3D image of body structures, like bones and some soft tissues. Benefits include that it provides substantially better detail than conventional x-rays. Blood clots, subtle and advanced bone conditions, and organ injuries can be seen. It is great and less expensive of an option for patients who cannot have MRI imaging, such as those with metal implants, those with pacemakers, those with implanted devices, and such. Each scan can be costly at about $300 to $6,000, and refurbished scanners can cost from $90,000 to $650,000, while new scanners can cost $285,000 to $2.1 million. They are very quick, though, when it comes to the scanning process, and the actual scanning process can take about 5 to 10 minutes. Limitations are these are less effective than MRI at distinguishing different types of tissue. Also, claustrophobia is a concern because the actual instrument that performs a CAT scan or CT scan can be pretty cramped and scary for those with claustrophobia. Magnetic resonance imaging. It uses high-frequency magnetic waves in order to excite hydrogen nuclei. Unlike with X-ray radiation, this does not involve ionizing radiation or radiation that can ionize or convert into ions parts of molecules in the body. This imaging class is again just for structural information, and the purpose is to build a 3D image of body structures, which include soft tissues, nerves, and blood vessels. The benefits are MRI is excellent for spotting sport injuries and musculoskeletal conditions, even when extremely subtle. Excellent for cartilage loss, joint inflammation, nerve compression, spinal injuries, injuries to ligaments, tendons, muscles, and cartilage. MRI, unlike CT, MRI is great at distinguishing tissue types from one another, and it's a very quick scanning that is around half an hour in time to do for the full body. Limitations are it's much more expensive and less widely available option for structural imaging, certainly so compared to CT scans. MRIs typically need their very own room, especially since there's not a lot of equipment you can have around. An instrument that produces a very incredibly strong magnetic field. Now, each scan can be, depending on how good of a scan it is, can range from $400 to $12,000, with a scanner ranging from $150,000 to $3 million. Loud noise during the actual scanning can also be a source that causes patient anxiety upon listening to it, as a magnet is being spun very quickly around you. Now that ends the structural portion of our medical imaging, those that give us information on bones, tissues, different parts of the body, current conditions based off of the physical shape of the body. Let's look at now single photon emission computed tomography, or SPECT scanning. This method of imaging uses internally produced electromagnetic radiation, or gamma radiation, from an injected radio tracer. Essentially, a radio tracer, a chemical in solution, is injected into the veins, and then as this travels around, that radio tracer that was in the solution that got injected into the body is radioactive. It starts breaking down, or it has excess energy and releases that excess energy as gamma ray photons, which can then be measured by a SPECT scanner. Benefits are it is great for spotting healthy organ function, hyperactivity, or underactivity of those organs. It can monitor blood flow in organs and look for mental health conditions. Seizures, strokes, and brain tissue tumors have all been evaluated through SPECT scanning. It is less expensive than PET scanning, and the radio tracers are cheaper and more readily available than those used in PET scanning. These include technetium 99M, iodine 123, an isotope of iodine 131. Again, this is a functional information type of medicinal scanning that gives us information on whether certain parts are active over others. The limitations are that it is limited in availability. The diagnostic scanner can cost $400,000 to $600,000, and the scan itself can easily be over $1,000. And this is meant to build a 3D image of the structures of organs and tissues. Lastly, we have PET scanning or positron emission tomography. Think of how we talked about in chemistry an atom, which consists of sometimes protons and neutrons in the nucleus. However, it also consists of a very negative electron that orbits around the outside of the nucleus. The method of imaging, again, is using the internally produced positrons from an injected radio tracer. Positron is an anti-electron. It has the same mass as an electron, but instead of being positive, it is negative. Or instead of being negative like an electron, a positron is positive for however long electron Hulk is out. This image class is meant to give functional information as well, and the purpose is to build a 3D image or structure of organs and tissues. The benefits are it is phenomenal at detecting and monitoring cancer, heart disease, and brain disorders. The reason being is because the chemical used as a radio tracer in PET scanning is similar to glucose sugar. Therefore, cancerous regions which are trying to hoard up a lot of resources, we would see a lot of positron activity being released from absorbed portions due to the cancer cell or cells hoarding ingredients. The release of positrons, once that radio tracer is absorbed, will help diagnose and determine the severity of cancer. The limitations are it is limited in availability. Typically has its own room for this particular diagnostic device. The diagnostic scanner can cost around $1.7 to $2.5 million, and the scan itself can range from $2,000 to $24,000 depending on how advanced it is. Scans can take 1 to 1.5 hours to do, and the radio tracer fluorodeoxyglucose FDG is a concern for diabetes patients. It is a concern for diabetes patients, mainly because fluorodeoxyglucose is very similar to glucose, and it is metabolized very similarly to glucose in the body. Therefore, one must be careful if they are having issues absorbing glucose or burning it, or always have a lot toward the deep ground or toward the trunk of an elephant. This is a sign to show that it may be a little difficult for those who are on insulin or those who are diabetic, but for others it is a sugar analog that's radioactive. The fluorodeoxyglucose is the in my cousin Rachel's prior example. These are just just a concern. Again, positrons, they are just as that fluorodeoxyglucose is Breaking down, it is releasing positrons, high energy electrons that have a positive charge, which can be detected by the scanner. And yeah, that concludes our little mini review of different types of medical imaging, at least in brief. And this will be our last lesson for now. Perhaps there'll be more. As always, likes and subscribes are not necessary, but they are appreciated and fun to see. In any case, just around the 15.5-minute mark. Glad to have you all, and peace.